Dr. Ryu Sanghyo, he's in the studio. Good morning.
Good morning. It's raining outside.
I know, and you were mentioning how you enjoy the rain, right?
Yeah, I love raining. I don't know, but I didn't like raining when I was young.
Right.
But as I get older, I get to like raining.
I like the rain if I'm indoors, not driving, not walking. If I'm indoors, I love the sound of it. And there's a certain smell that's emitted when it rains, right?
That's right.
And when I was younger, I hated that smell, but now it's kind of like I'm okay with it. 그러니까 안에서 그 막 포근하고 when you're like nice and cozy, it's okay.
Yeah,
but when you're driving,
that's
it's
right.
terrible.
Same here.
Yes. Well, text topic before we jump in.
Okay, what is that?
Who do you go to vent or to pour out your heart out to?
Is our text topic?
Yeah, that's our text topic. Who do you confide in?
I used to confide in to many friends or family members, but these days I don't know. I just turn to God. That's all.
Oh, okay. To a higher being.
Yeah. The more I talk to somebody else about and then vent to my frustration, I think I tend to experience some kind of aftermath of it because the talking runs itself.
Oh.
So
right.
So I don't want to.
Okay, no. I fully get you. And other people on the board also saying some of them tend to be kind of more introspective.
Oh, that's right.
They talk to themselves or they kind of handle it on their own. So I guess for different folks, like different strokes, right?
Oh, you know what? Something just came across.
Oh.
Sometimes I vent to my frustration to my personal AI.
Oh, AI. It's a very common thing. Yes, many people do, right?
Okay.
Well, what's our topic for today?
Okay, today's topic is about superbugs.
Superbugs. Not like super like 바퀴벌레. We're talking about superbugs like viruses, bacteria?
Yes, bacteria.
Yeah, bacteria, right?
Yeah, because superbugs means there's no medicine, there's no antibiotics for this one.
Yes. So we're talking about these superbugs that are bacteria. And so what about antibiotics? Antibiotics like 항생제?
Yeah,
They don't work?
항생제. Yeah, they don't work. That's right. Superbacteria.
Okay.
Yeah.
So that's a major issue, right?
That's right, major issues. Because let's say that if bacteria are resistant to any big antibiotics,
yes.
there is no medicine for this one.
Not good.
Yeah.
And so, is this true? I think I read somewhere that South Korea's antibiotic usage is among the highest of like all the OECD nations. And I have to say, like when I first came to Korea, I was kind of surprised at like how frequently people visit clinics or how easily antibiotic prescriptions were handed out. So am I imagining it or is it true?
Is it true? Because there are several reasons.
Okay.
I brought three main reasons. In Korea, antibiotics have long been prescribed even for viral illnesses like colds and sore throats. Of course, antibiotics in that case don't work at all.
Because antibiotics are for... not for viruses.
Not for virus. It's
right.
for bacteria.
Bacteria, right.
Yeah, that's right. 예, 균을 죽이는 거죠. Not 바이러스를 죽이는 게 아니라
네.
항생제. And also people often expect a stronger medicine. So doctors sometimes feel really pressured.
But I hear though, like from people around me, like, 여기 가니까 좀 약을 세게 줘준다. Like they like it, because they want to get better quicker, right?
That's right.
Yes.
But it doesn't have any scientific background because antibiotics, if they have let's say that if you get a flu.
Yes.
Flu means virus.
Yes.
Virus is supposed to be staying in our body for a certain time. Like, let's say that regular flu stays in our body for 5 days, for instance. And if you go to one clinic and they prescribe some medicine for 3 days.
Yes.
And then your symptoms are not supposed to go away.
Right.
Because the virus is supposed to be staying in our body for 5 days.
Okay.
Then you go to another clinic and then that's fourth day, and then your symptoms don't go away. And then you take medicine for 2 days, and then you are not satisfied with this because your symptoms still linger in your body.
Sure.
And then you go to next one, and that's the time when your virus is about to leave.
Yes.
And then you think that, that clinic prescribed the right medicine. That is the real doctor.
That's a good point that you make. I'm glad that you pointed that out. So don't fall into that trap, listeners, right?
Yeah, that's right.
Don't be doctor shopping.
Yeah, doctor shopping. Yeah, that's right. And also, some studies in clinics and pharmacies prescribe prescriptions may not always be tightly monitored. It's another thing.
Yes.
And also, shifting antibiotics, it puts a risk of developing resistant strain of bacteria.
Yes, and so let's talk about that. Why is resistance so dangerous? Because when they do become resistant, the bacteria, how does that affect real life treatment?
Let's say that if a resistant bacteria infects someone, the usual antibiotics won't work.
Okay.
In that case, doctors must try stronger and more toxic, more expensive drugs, which means longer hospital stays,
Yes.
and higher medical costs, and even severe cases, death.
Ooh.
Especially dangerous for elderly and immune-compromised people and children.
Yeah, so, it sounds quite serious, right? What you're talking about right now, having, bacteria that might be resistant
Yes.
to the antibiotics. So I also remember reading something about the WHO, World Health Organization, calling antibiotic resistance one of the top 10 threats to global health. So
Exactly, that's right.
this is major.
Yeah, so WHO warned that without action, we could enter post-antibiotic era where routine surgeries, infections could once again be very fatal.
Okay.
Imagine minor cuts can be
Yes.
deadly.
Oh, now you're scaring us a little. So I don't want it to be all doom and gloom, right? So we want to bring you some good news as well, right? So the Korea Disease Control Agency, the KDCA, I hear started a pilot program last year to promote appropriate antibiotic use. Is that correct?
That's right. For those who don't know about pilot has nothing to do with the crew member in a cockpit. Anyhow,
They're testing something out. It's new.
It's
Yes.
new. And then it's called ASP, Antibiotic Stewardship Program. And hospitals participate and they assign trainee specialists to review antibiotic prescriptions. So they check whether the antibiotics are truly necessary.
Yes.
Or what type is best and how long it should be used.
Well, we do want to hear about, do we have any of the early results? What do they show?
Yeah, it's very promising. Every hospital in the program now runs a restricted antibiotic system, which means certain strong drugs can be only used under review. In contrast, only about half of non-participating hospitals do that. So they also encourage doctors to switch to narrower and safer antibiotics once lab results come back. Let me give you an example. Let's say that if I see a patient who
Yes.
presents with some cold, like pneumonia symptoms,
Yes.
doctors prescribe empirical antibiotics in that case. There are different kinds of germs, like gram-positive germs and gram-negative germs and Arabic germs, all kinds of germs. So let's say the A antibiotics is working on A germ, and B antibiotic is working on B germ. So doctors know in the first place. So we prescribe antibiotics empirically, and then we run some blood tests and then phlegm culture test, and then the test.
Kare? Yes.
Kare test.
Okay.
And it tells us that what kind of an infection is bothering this patient.
Okay.
So in that case, this patient is contracting this B bacterium, so that's why we prescribe antibiotics catering, targeting to that specific antibiotic. But just random, irrelevant antibiotics can increase the risk of resistance
Yes.
problems.
Right. And so in terms of even the differences between that I noticed personally, this is anecdotal, meaning this is my personal observance. In the States, it could have changed, but as when I lived there for over 30 years, I rarely went to see a doctor unless something was like bleeding profusely, like it was an emergency. I had to go to the emergency room, or somebody had a broken bone. Like I never went to the doctor for the common cold, because usually you could just go to a pharmacy and then they have rows upon rows of like cold medicine, but you have to be able to distinguish your symptoms because it's written on there like fever and cough, fever, cough, and then they have runny nose, and like every single brand has like 10 different types of cold medicine.
That's right.
You got to read through the symptoms, and then you take it to the counter and ask nicely because the pharmacist is usually very cranky. And you say, is this the right medicine? 아니, 진짜 눈치 보면서 물어봐야 돼요. 왜냐면 they handle so many sick people. And, is this correct? And they're like, read the label. Is literally what they said, right? And then I came to Korea and I was just like, oh, everybody's so nice. And they prescribe you medicines for every little symptom. And like, it was just like a culture change and shock for me.
That's right.
Yes.
Korea is famous for kindness and generosity.
Lots of medicine.
Lots of medicine.
And it's not that expensive
Yeah,
because you have health insurance,
very,
right?
Very affordable.
Yes.
So the downside of it, because it's so accessible and it's pretty much it's very cheap compared to other countries, advanced countries. So that's why we have this kind of issue.
Yes, yes. So, what would you say in terms of your final thoughts for our listeners today? Because I know that our listeners or waivers out there, they're smart people. They're tuning in every day. They are in the know. But about antibiotics for 항생제, what do we need to know?
Okay, there are 3 rules. Let me put it this way. First, don't demand antibiotics for a cold flu or coughs or some minor viral infections.
Yes.
And also, I want you to finish the course if antibiotics are prescribed. That's really important. It's not only it not only applies to antibiotics but also anti-TB medication.
Okay.
Speaking of TB, tuberculosis, 결핵, here in Korea, we have the highest TB tuberculosis incidence rate. And then I remember exactly the young lady, actually, she is 18 or 19-year-old girl who was infected with TB. And then she was supposed to finish the course for taking anti-TB medication for a year. But her symptoms went away after taking 2 months of anti-TB medication. She stopped it, and then TB kind of recurrent hit her again, and also she took the medicine and then went away. But she stopped frequently, and finally, the germ that's in her body, TB, was all drug resistant. So all the doctors in the ICU, she was really cute, but I could see a walking skeleton, and then she was just waiting for her death.
Oh my gosh.
So and then she died in the end. But
she did? She died?
Yeah, she died.
Because she didn't finish her course, the entire course of the medicine for tuberculosis?
That's right. That's why she knew that she would die in the end. So I couldn't get it out of my mind. The exact the scene, her eyes, and she knew that she would die in maybe 3 or 4 months, because all the way doctors say, "I'm sorry, we don't have any medication that are working on your body."
There's nothing more we can do.
No, nothing, because that's the danger. Okay, it's kind of a gloomy story, but there's a way we can turn it back,
yes.
And then we can improve our antibiotic kind of a situation. So stick to your schedule. Finish the full course if antibiotics are prescribed.
Yes.
And also never share leftover antibiotics. That's another common issue in Korea.
정말요. This is like so real and so true. You know, you've heard someone say, "Oh, do you have any like 항생제?" The answer should always be no. If you think you need, go to a doctor. Make sure you get checked out to see if you really need the antibiotics.
That's right.
And then, as Dr. Ryu just said, if you are prescribed antibiotics, finish the full course. If it's for 5 days, even if you feel better on day 3, finish it until the very end, right?
That's right. So before I go,
yes.
I'm going to wrap it up by saying this one. The greatest medicine of all is to teach people how not to need it.
Preventive,
and also you gotta know when to stop.
Yes.
Okay.
Well, thank you for bringing us this dose of antibiotics, what we need to know. And of course, we look forward to next week as well with you, Dr. Ryu.
Okay, thank you.
All right, everybody.